Hello and welcome to today's webinar, Sharper Skills in 30 Minutes Using Urban Footprint for COVID-19 Response and Recovery, brought to you today by the Urban Footprint Customer Success Team. I'm Andy Federer, and joining me today is Customer Success Manager Jason Hercules. Our Sharper Skills webinars are designed to highlight new features, showcase tips and tricks, and help you make the best use of the Urban Footprint platform. In this webinar, we'll brief you on how Urban Footprint, its integrated data, and its design tools answer questions raised by the COVID-19 crisis. This is the first of two webinars on this topic. Join us on July 29th for part 2. Before turning things over to Jason, I'd like to remind you that you can ask questions using the chat or Q&A feature in Zoom. As this webinar is relatively short, we'll save questions until the end. I'd also like to remind you that our next webinar in this series is scheduled for Wednesday, July 15th, and will cover 5 hidden powers of Urban Footprint plus 1 bonus feature. You can find a link to register for that webinar in our most recent newsletter. And with that said, I will turn things over to Jason.
All right, thank you, Andy. So understandably, COVID-19 and our coordinated responses to it likely is a main priority for many Urban Footprint users. And while the work that we did in support of the Center for Planning Excellence, for those of you that have seen it, included a number of advanced workflows, there are many basic workflows that you can start off with in Urban Footprint to help gain understanding and valuable insights and calibrate an appropriate response to the pandemic. Given the amount of time that we have in today's webinar, we'll only focus on the more basic assessment that you can perform using Urban Footprint at this point. So this includes understanding the COVID-19 cases and mortality data, leveraging the COVID-19 testing site data, and also assessing census data and census information in collaboration with those other data sets to gain insights. In part 2 of our resilience and recovery and COVID-19 webinar, we'll focus on showing walk accessibility to hospitals and other key features, leveraging the Food Access Research Atlas data, and also gaining insights from the chronic disease data from the CDC that's in Urban Footprint. As mentioned, we participated in a longer and more extensive conversation on resilient recovery and COVID-19 work that was applied to the specific use case in Louisiana, and that's also available online. All right. Unfortunately, COVID-19 cases are on the rise in several states, and the need for acute responses is imperative. So let's take a look at how a community in one of those states can make informed decisions on how best to deploy limited resources. I've created a project in Avondale, a city in Maricopa County, just outside of Phoenix, Arizona. Arizona is a state in which COVID cases are increasing, and working with a community of the size of Avondale will allow us to quickly gain some applicable insights, since we will be able to take in more information about the community at one time and be able to get a reasonable sense of things as we go along. The first thing to do is to understand the extent of the issue. So with that, we can start looking at data in Urban Footprint. First, let's take a look at the data that we have for COVID-19 cases by looking at the output from that layer of data, which has been set to a relatively recent date here in late June. We've added these data sets specifically to provide users with the ability to assess their circumstances based on the virus and make informed decisions. These data are sourced from USA Facts, a nonpartisan, not-for-profit civic entity that standardizes assorted data and makes it available for assessment. These data are provided at a national level, which allows for apples-to-apples comparison across states and indeed across the country. So we can see that in Avondale, which is located in Maricopa County, which has a really high number of cases. Since these data are collected at the county level, I've zoomed out to allow you to get a better sense of the comparative scale when assessing the number of cases in the surrounding county. But keep in mind that Maricopa County is very populous, and so it's not altogether surprising to see the level of difference that we're seeing right now between it and the surrounding counties. But that said, since the data is now juxtaposed, as you can see, with the county data from 2 months ago, so from April, you can see the growth in the number of cases within the county itself in a shorter period of time. Now moving over into mortality numbers, which is an unfortunate occurrence that is a part of this pandemic as well, we can use this information to help us get a better understanding of the virus's impact. So we're using another layer of data that we've specifically added for some of the COVID-19 response. This is the COVID-19 deaths layer. And we can see here and understand that there are a lot of the same considerations from the COVID-19 cases layer that apply to this layer as well. So it's a time series layer. We're looking at, again, the end of the month in June, and it aggregates the data at the county level. One thing to keep in mind is that while the movement and the trend for these data are similar, the magnitude of the difference of the data compared to the number of cases reported is quite different. So thankfully there are a lot fewer deaths than there are cases that have been occurred at this point. And so while the trend of the data looks similar, keep in mind that the absolute numbers for these data points are relatively different. And if necessary, you could, in UrbanFootprint, either change the data breaks to show what those differences are and have the data breaks be the same or similar so that the magnitude is communicated. Or you could also change the symbology of this data and have them be separate and kind of clearly communicate that to any stakeholder that there's some differences. Now we'll jump directly into the app. So give me 1 second to get that set up. All right, so let's take a deeper dive directly into the app. To help understand how well equipped Avondale is to identify COVID cases and therefore deal with them, we want to take a look at the availability of testing locations. So we'll zoom back into the community level. Remember, we were at the county level earlier just to give us a little bit more ability to compare the data across the county level that's provided for cases and mortality information. And I will start off by turning on the COVID-19 testing sites layer. So, and I'll even turn off our base canvas information. So you can see there are quite a number of testing sites in the area. But by going in and creating a 1 mile buffer around the project area, and I won't necessarily save this because I already have the buffer here, we're able to determine that there are a handful of sites actually within that 1 mile buffer. And then obviously the one testing site that's within the actual city limits itself. So just by doing this and taking these steps, this provides us with a pretty good understanding of the ability of services that are available, and parsing this with a little bit of additional information would give us even more insight. So given that there's only one testing site located in the city limits at this point, and the rise of cases in the county, let's assume that we're trying to determine a good location for a second testing facility. So just using some quick back of the napkin math and assuming an infection rate of 3%, we go back to our base canvas and using our data table, we can have an understanding of the total population, and applying that 3% rate, infection rate. This means that testing and eventually having treatment capacity for about 2,400 people at any one period of time would be a worthwhile objective for any planning or other efforts in Avondale. And so really just with using some of those data points, that provides us with another level of insight that we've gained. And in part two, when we start looking at some of the more specific data that you can apply, we'll take some of that information that we've gained just from understanding the population dynamics and metrics and show you how to apply that information. So now we have a sense of the capacity that's needed and understand the location of the sites. And now we want to take our next level of understanding. So next, we know that in general, there are certain socio-demographic groups that have been more adversely impacted by the pandemic. So using the data that UF can help us understand, we can understand the relationship of these populations and the resources that are available in the city. So essentially, where are some of these socio-demographic groups located in comparison to where that testing site is within the city? And then also you can keep in mind where some of the testing sites are even beyond the city within that 1 mile buffer area or so. So being able to assess diversity, age, and income distribution will help our understanding. To work with these data, it's simply a matter of just loading that information into our layer manager. So going into our layer manager here, letting that information load, and I could start a search for some of the data that I'm interested in. And you can see that they would load up here. I've actually already added all the layers that we want to take a look at this point. So I'm just going to close out of the layer manager, but just to show you that functionality and the ability to do that. For this sake, for this purpose, I'm going to turn off our base canvas and jump into the first data set that we're going to look at. So starting with diversity assessment, I'm going to use the census-based race and ethnicity census planning-based data in that layer to do some assessment. Turning that on, this obviously extends beyond the project area, but you can take a look and see that there are some relatively high percentage areas for the Latino and Latinx population. So just lining this up with the legend here and the different classes, you can see that there are a number of census block groups that have a relatively high population, including some of these areas that have populations that are over 80% Latino and Latinx. So we've identified some locations already that have a relatively high population that we'll want to take into account. And next, moving to the African-American population, which we can get to just by switching columns in this data set, in this same data set that we're already working with. You can see that there are some clear areas of more concentration, but I will point out that the population numbers aren't quite as high, but yet you can see that there is a pretty good trend of the distribution of African-American residents and where the higher concentrations are for those communities just by turning on this data set. So I've filtered out some of the breaking points for the data, including more than 50% Latinx population and more than 15% African-American population. And I've saved that as its own separate layer in my layer list. So by applying that filter and having it available by saving it, I can always go back and return to that information time and time again to reference those locations and to find those data sets. Now I'm going to turn to our census information for age. So I'll turn off my race and ethnicity data and I'll switch to my age database here. We can see that overall, there's not really a high concentration of seniors within the city limits. So a number of the concentrations of the locations with seniors are outside the city limits. And since we have this regional scale available, you can see that in, say, Sun City, which is an actual retirement community, and some of the other locations here, you can see that there really is a high concentration outside of city limits. But in the city limits, there's only a few census block groups that even start to approach the 25% senior population areas, and not even any that are immediately in the city limits that are more than 25% to approaching a third, as you can see with the classes as they're broken out here. So within the city limits itself, there aren't as many senior residents living directly in the city. So that's something else that we can take into consideration there. And then finally, let's move over into, back out a little bit here. Let's move over into income information. So just orienting ourselves here on the income information, you can see that the lower income residents, or the census block groups that have a high concentration of lower income residents would be located here with the darker black, or the darker brown, I should say, color symbology. And so a good number of the lower income census block groups also correspond to the census block groups that identified as being having a high Latinx population, or having at least a more highly concentrated African-American population as well. And we know from the research so far that those are a couple of the community groups that have been more adversely affected by COVID-19. So that can start to become part of our understanding for how we should work to address the availability of services, testing, otherwise, for some of those populations, and have a better understanding of what that means in terms of finding a good site for a second testing site. Let me turn off our database information here. And to further support our understanding, we can use our available transit data to map the location of transit infrastructure, so transit lines and transit stops, with an understanding that if we want to try to serve the folks in most need, some of those populations might be transit dependent, and so we want to have an understanding of where the transit resources are that we'd want to be able to apply. So I'm just going to go in, and we've got transit stops that are for the entire regional area. I've actually gone in and I've filtered that down to just the transit stops that are in the relatively recent adjacent area for Avondale. So we can zoom into that a little bit more. And so just by turning on that information and making it visible, we can actually eyeball what locations are close to transit infrastructure. But to be even more precise, you can take our network-based analysis results and filter that. So I've run my analysis module here for transit and also walk accessibility. And in this case, I'm interested in walk accessibility to transit. So I could turn that information on. And so this is walk accessibility to the nearest transit stop. And I can filter that down to a reasonable walking distance, in this case, 10 minutes. And then apply a buffer to that location. And that's going to tell me the area in which there's a reasonable or 10-minute walking distance to transit stops. So we can know where the test facilities could be placed that would be within a 10-minute walk from transit facilities. So I've created a filter, or excuse me, a buffer based on that. And so I'll turn off this transit data. I'll turn on the buffer here. And so that essentially now provides us with a buffer for the areas that are within the 10-minute walk of transit infrastructure. So putting all those steps together, including the buffer for transit information, the census block groups that we've identified, and joining that information together, in less than 30 minutes or so, we've been able to pretty well quantifiably identify some of the best locations to investigate the placement of another testing site. So I've taken the results of this buffer, I've joined them with those census block groups that I've mentioned that had the population profiles that we looked at. And essentially it has provided me with a final layer based on my base canvas that I'll turn on now. I'll turn off that buffer that shows us basically the land use map for all those different criteria that we looked at previously in terms of transit access, in terms of areas that have a high concentration of population members that would probably be impacted more heavily by the virus. And so now that we've been able to apply all that consideration together, we are able to start to have a clearer and more concise conversation to determine where the sites can be located and understand what resources would be needed to help be prepared to better respond to community needs. So for example, even though there are generalizations that could be made for the population in the Phoenix metro area in terms of assuming that there are a lot more senior residents because of the movement to the area because of the climate, and the understanding that there's generally a large Latinx population in the Phoenix area. By providing a more concise assessment and analysis, we were able to see that the senior population was actually lower than expected, or lower than you would make for a generalization of the area. But there were significant and significantly large Latinx residents, or areas with Latinx residents, including some census block groups that were more than 80% Latinx. And therefore, in terms of investing in community resources, you can make a determination that says having bilingual services might be more important than having services with expertise in senior care for your second facility in Avondale, because of the demographic information that we used as for our analysis. And so given that the testing sites that we've already identified, which are here, already includes, and I'll move this up on top here so that it's a little bit clearer, but it's also blue. It's showing up right here against the land use, but the existing testing site within the city is already located here, which is actually a good thing in terms of some of the demographic analysis that we've done. These census block group areas here and the land use that we're seeing right now for these areas indicates that this is probably a good location, a good destination to focus on identifying a site for a second testing location, given the proximity to transit, given the population that it would be serving, and putting that analysis together to help identify the appropriate location. So as mentioned, in less than half an hour or so, we've been able to have a reasonable analysis and an outcome that helps us determine where it might make the most sense to invest in new testing resources in Avondale to help the population. So as mentioned, Andy, we were going to keep this fairly basic and save some time for question and answer as well. And we'll plan to do some more advanced analysis in part 2 at the end of the month. So with that, Andy, I'd like to turn it back over to you for questions. And hopefully this was a useful overview for folks that are attending.
No, thank you, Jason. Looking forward to part 2. One question that came up was, will this recording be shared? The answer is yes. Stay tuned. We will be sending out a link to the recording in one of our upcoming newsletters. So look forward to seeing that there. As always, you can check out our YouTube channel. We have previous webinars and other content available there. So if you're ever interested in going through the archives, we have lots of great stuff already posted up there. Let's see, kind of looking through the questions here, one thing that kind of stuck out to me was, we know COVID has sort of broad impacts across the board, and you pulled up sort of transit, and transit's one of the areas that COVID is kind of wreaking havoc on. So how does that play into the type of analysis that you can do in UrbanFootprint?
Yeah, that's a good question. Thanks, Andy. So there's a couple of different ways that you can assess the impact of transit. And so one of the ways that can happen is with the level of transit service that has been provided for the area, both before and after COVID. So if you are looking for a long-term strategy or a long-term placement, maybe you want to just focus on the current existing full transit service that's available, with an assumption that at some point we'll be able to return to that level of service. So that's the transit stops layer that you see here, and also the transit stops Avondale area layer that I've filtered down to just within the 1 mile area of the transit area. We did also provide a transit stops after COVID services have been updated for a number of communities. And I'll actually switch to that data, and I've done the same thing where I've kind of narrowed it down to Avondale only. And what I'll do is now kind of toggle between those two transit data, because you'll see that there are some stops that have been removed because of transit or because of COVID-19 response. So the transit services and ability to continue to provide services, or at the very least being very strategic about the service that they're applying, means that they've at least stopped servicing these bus stops for the time being to be able to provide more service, or just to be able to keep the level of operations going. And so as I toggle that off and on, you can see in that area that there's some areas where bus service or transit service has been reduced due to COVID-19. So what that means is that if those areas were part of our assessment, you would maybe consider removing those from your assessment locations, because that wouldn't be a reliable transit service for residents to use to get to the testing site. You can see, fortunately, for the area that I identified as a strong location for a second testing site, the level of service, at least the bus service that is provided, is still there. The level of service might have changed some, and you'd be able to look at that information, and that's actually the next step of what we'll review here quickly. But you can see that that area is still provided with service, even as you look at the kind of the difference in before and after service that's been provided. So that's part of the assessment that you can do to start off with. And I'll switch back to our bus service just to have some numbers that are more reliable for us to assess in terms of quality of service now at this point. So I'm going to go into our transit stop layer that we've been referencing for this assessment. And the other thing that you can start to look at now is the kind of the level of service, to understand, yes, there is a bus line that services an area. There are stops along the route, but will it be frequent enough transit that folks can reliably use that transit to be able to get to testing sites, for example, or just being able to assess that level of service. So since I'm working with my transit stops layer, I can actually go in and start to apply a filter to that data. The data columns are also available here in the data table, so you could work through those data columns as well. But just with my familiarity with the layer, I'm going to go to the hourly arrivals for peak weekday service, AM weekday service, and I'm going to use that as my filter. And you can see that that this ranges from 0.5 hourly arrivals, so essentially one arrival every 2 hours, essentially. So some kind of commuter service that doesn't have a lot of frequency, or probably more of a inter-community service provider that doesn't have to provide a lot of frequent service. It just operates on a frequent schedule, to 4 arrivals per hour, so essentially the 15-minute or so headway. So if I wanted to find a service that's at least every half hour or so, I'd be able to go in and change this to at least 2 arrivals per hour. So, and then I'll have to zoom in a little bit here so that you can see, but a little too far. But in doing that, again, going back to this corridor that we've identified, and it's a little bit harder to see with the point data sets here, but you can see these transit stops with the darker circles that have been filled in. Those are the ones that have been selected. These transit stops that have the open data or the open symbology here are the ones that have not been selected. So even along this corridor, this is identifying that there is a route that provides at least more frequent service. It looks like there's some sort of a deadheading where the transit route going in is more frequent, and then less frequent heading back out. But ultimately now you've been able to apply a filter that tells you the level of service that you'd be able to work with, and that would help you identify, again, along with this, or in keeping with this scenario that we pulled together, locations that not only are near transit, but are closer to higher quality transit. So that would be part of your quantifiable assessment that you'd be able to apply when identifying an appropriate location.
Okay, well, great. Thank you, Jason. I think that takes us through to the end of today's webinar. Really appreciate everyone's time. And as mentioned earlier, we will be posting a recording of this on our site and our YouTube channel shortly. Thank you all, and look forward to seeing you at our next Sharper Skills webinar.